NCSBN RN 800 questions with answers newest practice exam. Question 1. A client with tuberculosis is suctioned. What is the suctioning protocol? Option A, suction for 20 seconds. Option B, hyperoxygenate before and after. Option C, suction for 30 seconds. Option D, use clean technique. The correct answer is option B, hyperoxygenate before and after. Hyperoxygenation is critical before and after suctioning to prevent hypoxia in clients with lung disease. Question 2. Why is vitamin B6 given with isoniazid for tuberculosis? Option A, increases activity of isoniazid. Option B, increases activity of rifampin. Option C, improves nutritional status. Option D, reduces peripheral neuropathy. The correct answer is option D, reduces peripheral neuropathy. Isoniazid depletes vitamin B6 levels, leading to peripheral neuropathy. Question 3. What is the essential action to prevent drug-resistant tuberculosis? Option A, monitor liver function. Option B, monitor renal function. Option C, assess respiratory isolation. Option D, monitor compliance with therapy. The correct answer is option D, monitor compliance with therapy. Consistent compliance with the medication regimen is the only way to prevent the development of resistant bacteria. Question 4. A cardiac client drinks 8 ounces of milk, 4 ounces of tea, and 6 ounces of coffee. What is the total intake? Option A, 500 milliliters. Option B, 540 milliliters. Option C, 600 milliliters. Option D is 655 milliliters. The correct answer is option B, 540 milliliters. 1 ounce equals 30 milliliters, so 18 ounces multiplied by 30 equals 540 milliliters. Question 5. A client states, I have pain in my left shoulder. This is considered option A, evaluation process. Option B, objective information. Option C, subjective information. Option D, complaining. The correct answer is option C, subjective information. Subjective information is provided directly by the client regarding their symptoms. Question 6. Before completing a nursing diagnosis, the nurse must: Option A, write goals. Option B, perform an assessment. Option C, plan interventions. Option D, perform evaluation. The correct answer is option B, perform an assessment. A nursing assessment must be completed before a valid nursing diagnosis can be formulated. Question 7. What is the correct action once a nasogastric tube passes the oropharynx? Option A, tilt head backward. Option B, have client swallow. Option C, have client hold breath. Option D, have client cough. The correct answer is option B, have client swallow. Swallowing closes off the airway and assists the tube into the esophagus. Question 8. When assessing residual volume, feeding should be delayed if the amount exceeds: Option A, 20 milliliters. Option B, 25 milliliters. Option C, 30 milliliters. Option D, 50 milliliters. The correct answer is option D, 50 milliliters. Residual volumes exceeding 50 milliliters indicate poor digestion and warrant withholding the next feeding. Question 9. Ascites is caused by: Option A, decreased plasma proteins. Option B, electrolyte imbalance. Option C, decreased renal function. Option D, portal hypertension. The correct answer is option A, decreased plasma proteins. Decreased plasma proteins lower osmotic pressure, causing fluid to leak into the peritoneal cavity. Question 10. A complication of cirrhosis is bleeding. What should the nurse administer? Option A, a vitamin C. Option B, a vitamin K. Option C, a vitamin E. Option D, a vitamin A. The correct answer is option B, vitamin K. Vitamin K is essential for clotting and requires liver function for absorption. Question 11. A client has a colostomy. Which food should he avoid? Option A, peanut butter. Option B, corned beef and cabbage. Option C, oatmeal. Option D, a tuna on whole wheat. The correct answer is option B, corned beef and cabbage. Cabbage is a gas-forming food that should be avoided by colostomy clients. Question 12. A client has white patches in the mouth that cannot be rubbed off. This is option A, a xerostomia. Option B, candidiasis. Option C, leukoplakia. Option D, stomatitis. The correct answer is option C, leukoplakia. Leukoplakia appears as white patches that cannot be rubbed off the oral mucosa. Question 13. Which client's statement about HIV indicates a need for education? Option A, HIV is transmitted by sexual contact. Option B, condoms reduce transmission. Option C, HIV is transmitted by casual contact. Option D, HIV can be transmitted to an infant. The correct answer is option C. HIV is transmitted by casual contact. HIV is not transmitted through casual contact such as hugging or shaking hands. Question 14. Which statement about benign brain tumors is true? Option A. They are just as dangerous as malignant tumors. Option B. They grow faster than malignant. Option C. They do not warrant concern. Option D. They can be removed surgically. The correct answer is option A. They are just as dangerous as malignant tumors. Benign brain tumors can destroy nearby structures or increase intracranial pressure just like malignant ones. Question 15. What is the most important nursing action for a client with renal calculi? Option A, intake and output. Option B, a daily weights. Option C, a straining of all urine. Option D, oxygen therapy. The correct answer is option C, straining of all urine. Straining urine is essential to catch and analyze the stone. Question 16. What is the appropriate diet for calcium phosphate renal calculi? Option A, high calcium low phosphorus. Option B, low calcium high phosphorus. Option C, 2 grams sodium. Option D, low calcium and phosphorus acid ash. The correct answer is option D, low calcium and phosphorus acid ash. Low calcium and low phosphorus prevents the formation of calcium phosphate stones. Question 17. Which insulin is indicated in diabetic ketoacidosis? Option A, humulin N. Option B, humulin R. Option C, humulin U. Option D, humulin L. The correct answer is option B, humulin R. Regular insulin is rapid-acting and is the only insulin used in emergencies like ketoacidosis. Question 18. Which solution is used to treat diabetic ketoacidosis? Option A, D5 in normal saline. Option B, a D5W. Option C, a 0.9 normal saline. Option D, a D5 in lactate ringer. The correct answer is option C, 0.9 normal saline. Normal saline is used initially to rehydrate the client without adding glucose. Question 19. What is a primary symptom of diabetes insipidus? Option A, anuria. Option B, oliguria. Option C, dysuria. Option D, polyuria. The correct answer is option D, polyuria. Polyuria is a primary symptom due to deficient vasopressin. Question 20. Which blood product is indicated for massive blood loss? Option A, whole blood. Option B, platelets. Option C, a fresh frozen plasma. Option D, packed red blood cells. The correct answer is option A, whole blood. Whole blood replaces all components lost during active hemorrhage. Question 21. A pregnant client has been pregnant twice before and has delivered 2 children after 20 weeks gestation. How is this recorded in the Gravida and Para system? Option A, Gravida 3 Para 1. Option B, Gravida 3 Para 2. Option C, Gravida 2 Para 1. Option D, Gravida 2 Para 2. The correct answer is option B, Gravida 3 Para 2. Gravida refers to the total number of pregnancies and Para refers to the number of deliveries after 20 weeks gestation. Question 22. A client with severe preeclampsia is receiving magnesium sulfate. When is it safe to repeat the dosage? Option A. Deep tendon reflexes are absent. Option B. Urine output is 20 milliliters per hour. Option C. Magnesium sulfate serum levels are above 15 milligrams per deciliter. Option D. Your respirations are greater than 16 breaths per minute. The correct answer is option D. Respirations are greater than 16 breaths per minute. A respiratory rate greater than 16 indicates that toxic levels of magnesium have not been reached and it is safe to proceed. Question 23. Which blood pressure change from baseline would be most significant for the nurse to report as indicative of preeclampsia? Option A. 136/88 to 144/93. Option B. 132/78 to 124/76. Option C. 114/70 to 140/88. Option D. 140/90 to 148/98. The correct answer is option C. 114/70 to 140/88. Pregnancy-induced hypertension is defined as an increase in systolic blood pressure of 30 mm of mercury or diastolic by 15 mm of mercury. Question 24. In which phase of the menstrual cycle does progesterone thicken the endometrial lining? Option A. Menstrual phase. Option B. Proliferative phase. Option C. Secretory phase. Option D. Ischemic phase. The correct answer is option C. Secretory phase. The hormone progesterone is secreted by the corpus luteum and causes the uterine endometrium to swell during the secretory phase. Question 25. To remove the baby from the breast during breastfeeding, what should the mother be instructed to do? Option A. Gently pull the infant away. Option B. Withdraw the breast from the infant mouth. Option C. Compress the areolar tissue until the infant drops the nipple. Option D. Insert a clean finger into the baby mouth beside the nipple. The correct answer is option D. Insert a clean finger into the baby mouth beside the nipple. Inserting a finger into the infant mouth beside the nipple breaks the suction and prevents nipple trauma. Question 26. A mother is 12 hours post-delivery and her uterus is boggy high and deviated to the right. What is the priority nursing action? Option A. Notify the physician. Option B. Place the client on a pad count. Option C. Massage the uterus and re-evaluate. Option D. Have the client void then re-evaluate. The correct answer is option D. Have the client void then re-evaluate. A full bladder is the most common cause of uterine displacement in the postpartum period, so the client must void first. Question 27. A new mother asks about the white cheese-like substance under her baby arms. What should the nurse respond? Option A. This is a normal skin variation. Option B. The baby may have an infection. Option C. This is vernix and it will disappear in a few days. Option D. The sebaceous glands are plugged. The correct answer is option C. This is vernix and it will disappear in a few days. Vernix caseosa is a protective white substance that covers the fetus in utero and normally disappears shortly after birth. Question 28. A fetus is in a left occipito-anterior position. Where are fetal heart sounds best auscultated? Option A. Below the umbilicus toward the left side. Option B. Below the umbilicus toward the right side. Option C. At the umbilicus. Option D. Above the umbilicus to the left side. The correct answer is option A. Below the umbilicus toward the left side. Fetal heart sounds are easiest to auscultate through the fetal back, and in the left occipito-anterior position the back is on the maternal left. Question 29. Which of these alterations is considered abnormal during pregnancy? Option A. Striae gravidarum. Option B. Cloasma. Option C. Dysuria. Option D. Colostrum. The correct answer is option C. Dysuria. Dysuria is a clinical danger sign during pregnancy and may indicate a urinary tract infection requiring prompt investigation. Question 30. A client at 35 weeks gestation has 3 fetal movements with accelerations of 15 beats per minute lasting 15 seconds. How is this interpreted? Option A, non-reactive. Option B, reactive. Option C, positive. Option D, negative. The correct answer is option B, reactive. A reactive non-stress test is defined by at least 2 accelerations of the fetal heart rate with fetal movement in 20 minutes. Question 31. What is the most appropriate nursing goal for a client in the transition phase of labor? Option A, maintain client privacy. Option B, assist with assessment procedures. Option C, provide strategies to maintain client control. Option D, enlist additional caregiver support. The correct answer is option C, provide strategies to maintain client control. The transition phase is the most difficult part of labor, and nursing actions should focus on helping the client maintain control. Question 32. What does a station of +2 mean? Option A, a presenting part is 2 cm above the ischial spines. Option B, biparietal diameter is at the level of the ischial spines. Option C, presenting part is 2 cm below the ischial spines. Option D, biparietal diameter is 5 cm above the ischial spines. The correct answer is option C, presenting part is 2 cm below the ischial spines. Station refers to the relationship of the presenting part to the ischial spines, with positive numbers indicating descent below the spines. Question 33. A fetus is in a vertex presentation with the occiput located in the maternal right anterior quadrant. How is this noted? Option A, right occipito-posterior. Option B, right occipito-anterior. Option C, right sacro-anterior. Option D, left occipito-anterior. The correct answer is option B, right occipito-anterior. The notation right occipito-anterior indicates the fetal occiput is in the mother right anterior quadrant. Question 34. A client in dysfunctional labor has contractions decreasing in frequency and intensity with marked molding. The physician orders oxytocin. The nurse should: Option A, begin the infusion as ordered. Option B, increase dosage by 2 milliunits every 15 minutes. Option C, maintain dosage for 40 to 60 second contractions. Option D, question the order. The correct answer is option D, question the order. Oxytocin is contraindicated in dysfunctional labor until cephalopelvic disproportion has been ruled out. Question 35. Which statement by the nurse correctly coaches a Lamaze-prepared client in active labor? Option A, breathe with your abdominal muscles. Option B, take a cleansing breath then focus on shallow chest breaths. Option C, take slow breaths using abdominal muscles. Option D, take rapid deep breaths. The correct answer is option B, take a cleansing breath then focus on shallow chest breaths. In Lamaze preparation, every patterned breath is preceded by a cleansing breath, and shallow paced breathing is used as labor progresses. Question 36. Which statement by a family member indicates the need for further teaching about home enteral feedings? Option A, if diarrhea lasts 2 days I will contact the doctor. Option B, I should anticipate weight gain of 1 pound per day. Option C, it is important to keep the head of the bed elevated. Option D, I should use open formula within 24 hours. The correct answer is option B, I should anticipate weight gain of 1 pound per day. A consistent weight gain of more than 1/2 pound per day should be reported to the provider, as it may indicate fluid overload. Question 37. A postoperative hip client complains of cramp in his right leg. What is the appropriate nursing action? Option A, assess for pain with plantarflexion. Option B, assess for edema and heat of the right leg. Option C, instruct him to rub the cramp. Option D, elevate extremity with pillows under the knee. The correct answer is option B, assess for edema and heat of the right leg. Swelling and warmth along the affected vein are common clinical manifestations of a deep venous thrombosis. Question 38. Which laboratory study is ordered to monitor the therapeutic effects of heparin? Option A, partial thromboplastin time. Option B, hemoglobin. Option C, red blood cell count. Option D, prothrombin time. The correct answer is option A, partial thromboplastin time. Partial thromboplastin time is the specific laboratory test used to monitor the therapeutic effects of heparin therapy. Question 39. Which response by a client being discharged on warfarin indicates the need for further teaching? Option A. I will use an electric razor. Option B. I will inform my dentist about anticoagulant therapy. Option C. I will continue my usual dosage of aspirin for arthritis. Option D. I will wear an identification bracelet. The correct answer is option C. I will continue my usual dosage of aspirin for arthritis. Aspirin should be avoided because it interferes with platelet aggregation and potentiates the effects of warfarin. Question 40. What value represents a therapeutic theophylline level? Option A, 14 micrograms per milliliter. Option B, 25 micrograms per milliliter. Option C, 4 micrograms per milliliter. Option D, 30 micrograms per milliliter. The correct answer is option A, 14 micrograms per milliliter. The therapeutic blood level range for theophylline is 10 to 20 micrograms per milliliter. Question 41. When administering albuterol and beclomethasone via inhalation, what is the correct sequence? Option A, glucocorticoid then bronchodilator. Option B, a bronchodilator then glucocorticoid. Option C, alternate successive administrations. Option D, client preference. The correct answer is option B, bronchodilator then glucocorticoid. Bronchodilating the airways first allows the glucocorticoid to penetrate deeper for maximum effectiveness. Question 42. To prevent fungal infections of the mouth from inhaled steroids, the nurse should teach the client to: Option A, rinse the plastic holder with peroxide. Option B, rinse mouth and gargle after each use. Option C, take antacids before inhalation. Option D, rinse mouth before use. The correct answer is option B, rinse mouth and gargle after each use. Rinsing the mouth and gargling with warm water after use minimizes the risk of oral fungal infections. Question 43. Which statement indicates the need for further teaching for a client with chronic obstructive pulmonary disease? Option A, eat high-calorie, high-protein foods. Option B, take vitamin supplementation. Option C, eliminate intake of milk products. Option D, eat small frequent meals. The correct answer is option C, eliminate intake of milk products. Milk does not make mucus thicker and is a nutritious source of calories for these clients. Question 44. A dose of theophylline may need to be altered if the client with chronic obstructive pulmonary disease is concurrently taking: Option A, morphine. Option B, medication for arthritis. Option C, medication for machinery operation. Option D, cimetidine. The correct answer is option D, cimetidine. Cimetidine decreases theophylline clearance, leading to increased blood levels and a higher risk of toxicity.